All right, Dr. Auber, thank you for joining us today. Could you please just spell your name for me?
Auber.
All right, thank you, sir. Now, getting into pancreatic cancer, we're going to start with some general questions that we have. I want to ask, how many cases of long-term survival are known for those who've been diagnosed in the locally advanced or metastatic phase?
Well, pancreas cancer is probably the worst solid tumor that anybody can get, unfortunately. This has the worst statistics because if you look at GI tumors, those are worldwide the most common type of malignancies, but that includes many other than pancreas: colorectal, stomach, esophageal, small bowel, and so on, and liver cancer too. So pancreas cancer is getting right behind or right next to colorectal cancer, which is about, maybe in the US, colorectal cancer 150,000 new cases per year, pancreas cancer about 37,000 per year. But while we are fairly successful in curing colorectal cancer patients, perhaps maybe if you take the amount of patients who die from the disease and amount of patients that discovered each year as new diagnosis, maybe 37% dying for colorectal cancer. But the case fatality ratio for pancreas cancer is well over 90%. That shows that almost everybody who gets the disease of pancreas cancer dies from it. So to answer the question, the cured patients is very small. It's definitely less than 5%, but probably closer to 1 or 2%.
I know it's difficult to find the origin. Have you ever heard of a case where they found the actual origin of the pancreatic cancer, something that may have led to it?
Well, there are many thoughts and speculations why is it so hard to find. Now, most of the time when it's diagnosed, more than half of the cases when they are diagnosed are advanced and metastatic and not curable. In fact, there was a large series from the world's largest cancer center, Sloan Kettering in New York, that over 800 patients with pancreas cancer were analyzed, and they found that approximately less than 20% of them were really considered potentially curable with surgery. Now, surgery is the only cure for pancreas cancer, and if it's resectable completely, then there is a chance of cure. But when they looked at these less than 20% of the over 800 patients, then when they actually underwent surgery, more than half of them were found to have other disease that's not permitted resection. And these patients who were selected for curative resection and then ended up complete resection was only about 40%. And then when they followed these patients, many of them did get back the cancer during the next several years. So it was probably less than 5% of the resected patients that actually were cured, and that puts the total number of cured patients only 1 or 2% of the 800 patients. Now, why is that so hard? One reason is that it does not have any very specific presentation. Many patients early of the case presents with a non-specific upset GI, upper GI tract and indigestion. And when somebody goes to the family doctor with indigestion, that's not going to get a CAT scan right away.